The eyes of the nation are on Pennsylvania as a key influencer to the 2020 election. PCN has over 25 years of trusted state government coverage. Our network is your platform to connect directly with Pennsylvania voters. Whether it's a presidential race, statewide campaign, or local cause, our viewers are ready to hear from you. Book your ad now. PCN, your access to Pennsylvania voters.
PCN brings the distinct aspects of Pennsylvania and its residents to your favorite screen.
Hear from state government and community leaders during unedited, balanced coverage of politics and policy.
Dig into the rich history and culture of the state, presented by notable residents and historians.
Score a view of the best high school, college, and world-class athletes competing across the state, and much, much more.
Start exploring the Keystone State today on PCN and the PCN app. The Pennsylvania Human Relations Commission is dedicated to informing the public about the diminishing access to housing. Chad Dion Lassiter is the Executive Director of PHRC, the top civil rights enforcement agency in Pennsylvania. He and his guests will discuss the systemic problems of discrimination and bias that limits access to the basic need of housing. Watch on cable and streaming free this Sunday at 3 p.m. Get more at pcntv.com.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Senator Sheriff Street, Democrat representing Philadelphia. Thank you for being with us today.
Thank you for having me.
Governor Wolf recently announced his agenda for the fall, which included a push to legalize recreational marijuana to help pay for COVID-19 grants. Do you support Governor Wolf's proposal?
Well, I mean, another way to put it is Governor Wolf, I'm glad Governor Wolf has joined to support my proposal. I'm prime sponsor of legislation to legalize the adult use of cannabis and have long been a proponent for the legalization of adult use for cannabis. I believe it's the right thing to do in terms of criminal justice, because although white and black folks use cannabis at roughly the same levels, black and brown people are 4 to 5 times more likely in the Commonwealth to be subject to law enforcement. It's the right thing to do for our farmers. It would be a great boon to our agricultural community. And it's the right thing to do for revenue purposes, because the Auditor General DePasquale estimates $600 million in recurring revenue from cannabis, the taxation of adult use cannabis.
And what is support like for your proposal in the rest of the Senate?
Well, all but 2 Democrats have already signed a letter supporting our initiative. And I would say that there are a number of Republican members who have intonated either in the press or in a number even more privately that they believe cannabis should and will be an important part of our revenue solutions.
Several counties in recent weeks have experienced COVID-19 spikes in cases. What is the trend of COVID-19 in your district?
Well, I'm in Philadelphia, where levels are relatively flat. That's not to say there aren't any new cases, but comparatively speaking, in our region, where Philadelphia is doing not so bad. Given the density, we know we have to be constantly very vigilant to make sure that we continue social distancing, continue to wear masks. But I think the governors, thanks to the leadership of the governor and the mayor's cooperation, I think we've been able to flatten the proverbial curve. We're far from over. We've got a long way to go, and we certainly would be doing better if we had the kind of contact tracing and mass testing that they're doing in other countries. But we're in the United States, and our federal government just hasn't taken the right steps to make that available. But given the constraints we have, I think we're doing pretty good.
And what are some of the concerns that you hear from people in your district on COVID-19?
Well, I think people are real concerned that we don't have the ability to do the level of testing, and as a consequence, people are concerned about when this is going to ever be over. I think there are a lot of concerns around schools and how we're going to and making sure that we're able to. Philadelphia's chosen to go all virtual through mid-November. People are concerned that we deal with the digital divide issues and make sure that all of our young people have access to a computer and to the internet so they can get a digital education. They're concerned about the small businesses, and the fact that the PPP program that the feds created pushed out loans to lots of really big businesses. Like I heard the Los Angeles Lakers got money, but so many Pennsylvania small businesses in my district didn't. Barbers and beauty salons were particularly hurt because they were forced to be closed and are looking to recover. People like the fact that we created a state grant program, but realized it was just not nearly enough money. So, there needs to be a much broader program, and know that we need a real federal response to the economic crisis, and we need a more adequate federal response if we're going to be able to do the testing and contact tracing to get this over with. But overall, I think people are happy that we're not spiking right now, but are concerned that without a real end to this pandemic, we could see future spikes.
You recently held a meeting with several of your Senate colleagues discussing legislation that would help businesses file claims for business interruption insurance. Tell us about that legislation and why you feel it's necessary.
Well, there are businesses, business interruption insurance, and insurance is supposed to help stabilize markets. It's supposed to deal with the uncertainty that exists with global businesses. Certainly, in this case, businesses experienced disruptions that created massive economic losses. The challenge is that with all these businesses experiencing these losses at the same time, we need to make sure the government needs to step in and make sure there's adequacy in relation to insurance. We at the state can do what we can. We certainly need to make sure that those who bought the right kinds of policies and with the expectation that those policies would pay out, they do. But for others, there may need to be a role for the federal government to step in and act as reinsurance for this market, like they do in the flood space, where when there's mass disaster, the feds step in, and while the insurance companies may process the claims, the feds actually provide some of the resource to make sure that we don't decollateralize all of our insurance companies. It's a complicated issue, but at the end of the day, the ordinary mom and pop businesses mustn't go out of business, because they're the job creators. They're the ones that reinvest their money in the community, and they themselves are members of our community who have families that need to be sustained.
And beyond this legislation, this insurance legislation, what further legislation would you like to see to continue to support businesses that have been affected by COVID-19?
I think we need to have additional grant relief. We did a program that allowed for us to invest in the Commonwealth to invest in making grants to businesses that experienced losses. We ran that money through community development financial institutions. That program was tremendously successful, but we simply need to put a lot more money into it, because there are a lot more businesses that need help. And so I think the model of that program was good, but the scale of it was inadequate. And so while it was, and even though it was inadequate, that's not to say it wasn't historic in the scope, because it truly was. We helped thousands of businesses, but even thousands and thousands of more need help. So I think that the program we ran through the CDFIs made a lot of sense, but they just need to be administering a lot more money so they can get a lot more grants out to people.
And finally, with social unrest revitalized following the shooting of Jacob Blake, what further legislation would you like to see to continue to address the issues of police brutality?
Well, I mean, look, the House should take up the legislation I've introduced that passed the Senate, requiring governing use of force and banning chokeholds. The House should pass legislation that Senator Costa introduced that passed the House Senate unanimously, that dealt with a database to track officers who've been fired for misconduct and use of force. So we can start there. I think we've taken some important steps in bills that passed the House and the Senate in this regard. But I would, if you were to talk about where you should start, my chokehold ban bill and use of force ban, which not only dealt with chokeholds, which was after the killing of George Floyd, the focus, but dealt with making sure that every police department had a use of force policy that was approved by a municipal officers training corp company, and was also and that Senator Costa's bill where we could track what happened so that an officer couldn't be fired for misconduct and then rehired at another police department, which led to the killing of Antoine Rose in East Pittsburgh. So I think we have a couple pieces of legislation sitting on the House floor that already passed the Senate, and that should be our first step. And that's not to say that's the end of the road, but those are the next steps we should take.
All right, Senator Sheriff Street, Democrat from Philadelphia, thank you so much for your time.
Thank you.
PCN is committed to keeping Pennsylvanians informed through this difficult time. Join us for Coronavirus Impact, a discussion with civic, business, and government leaders on COVID-19's impact in Pennsylvania. Watch episodes on demand, plus live, up-to-the-minute information from the Governor and Department of Health at PCNTV.com. Watch PCN on cable and stream free on the PCN app.
I'm here with Dr. Tracy Conti, Executive Vice Chair for the Department of Family Medicine at the University of Pittsburgh School of Medicine. Thank you for being with us today.
Well, thank you so much for having me.
With fears of a second wave of COVID-19 coming in the fall, as well as flu season approaching, tell us about why it's important for people to get their flu shot.
Yeah, this is such an important thing for us this fall, and we've really been trying to reach out to our patients. In general, we are huge advocates of getting your flu shot every year. However, with COVID and the COVID pandemic and all the side effects from that, we want to ensure that our patients are actually getting their flu shot so we can help in diagnosis and aid if this is COVID or flu, and sometimes those symptoms are very similar, but just to ensure that our patients are as healthy as possible. Also knowing that, we're still in the physical distance and continuing to wash our hands, and a lot of patients aren't just going out. We want to make sure that when we do have interactions with patients that we are offering that flu shot so they can get it at the time.
And when is the best time for someone to get a flu shot?
Yeah. So for a younger population, as soon as they're out, right? As soon as you see them available, as if your doctor has them, go ahead and get that. For our older population, because we know that sometimes there is a waning in response to the flu vaccination. In the past, we really have said around, late September, October. This year, however, because patients aren't visiting the physicians as frequently, people aren't getting out as frequently because of the risk of being exposed to COVID. If it's an option of your doctor's offering it, I would go ahead and get it as soon as you can.
And when would you usually anticipate that the first flu shots are usually available?
I see them out now. I see them in pharmacies now. There are some physician offices that are getting them. I know my office in particular, we participate in vaccines for children. We've gotten our vaccine for children. We're waiting for our adult as well as our private stock for children. So, and I've seen all the advertisements. And so if you have the ability and you're comfortable, go ahead and get it. I wouldn't let that delayed October prevent you from going to get your shot.
What options are available for people who can't usually take vaccines, possibly because they're allergic or just don't usually get them at all?
Yeah, so that's a great thing about the flu vaccine, because they're flu vaccines that don't have that egg preservative that you can get it. For kids, there's even the flu mist shot that's available. For adults over 65, there's a high dose vaccine available. And so there's really nothing that should limit somebody from getting a flu vaccine.
As you mentioned earlier, one of the issues during this pandemic is that COVID-19 symptoms often manifest in the same way that flu symptoms do. As the flu season starts to come up, what are some ways that people can sort of make that distinction?
Yeah, we've always said call your physicians. Even when somebody had the flu before COVID, we wouldn't necessarily want patients that had flu symptoms coming out just because you could expose someone else. And so if you call your doctors, I think one of the biggest differences is that loss of taste and smell that you get with COVID that you don't that we have not seen with the flu.
Once a COVID-19 vaccine becomes available, will people still need to do some of the precautions that we've been doing, such as wearing masks and socially distancing?
I would hope not. I would hope that once we have everyone vaccinated, and I think that's the goal for trying to get the vaccination available, so that we can start living life as normal, and going out places and interacting with friends and family and colleagues like we did previous to this disease.
It may be too early to make assumptions about what the COVID-19 vaccine will be able to do, but will it be the type of vaccine that you think people will have to take annually, like the flu vaccine?
So I've heard lots of different things, and again, I am not the COVID vaccine expert, but what I have heard so far is that it looks like it may be an annual vaccine, but I just don't have the epidemiological nor vaccine research background to tell you for sure.
We've seen that this pandemic has disproportionately affected underserved, usually Black and Brown communities. In a regular year, is that the same? Is the disproportionate effect same for the flu in those communities?
So not really, not necessarily. I think when you have to take a why do we see COVID affecting these communities, it's several things, right? When you look at multi-dwelling housing and the ability to physically distance versus a higher socioeconomic status and not having that issue to deal with. When you look at the communities that are disproportionately affected, it's those communities of essential workers. And so they did not have the luxury of being able to stay home and work through telemedicine. They actually had to physically go out, which put them at risk. Along with the other chronic diseases that we see affect our underserved communities, particularly Black and Brown communities, that were already present before COVID. And really that is those are some of the reasons why we were seeing, COVID affecting our community so differently than it was other communities.
And what are some of the ways that you're aware of that UPMC is trying to address some of the needs of those communities?
Right. So I'm really excited because I've been a part of UPMC's subgroup on health disparities in particular. So I hope that you are aware that there was a gender inequality report that came out of Pittsburgh, and UPMC took action, right? They developed a subcommittee, and there's a primary care subgroup, there is a cardiovascular subgroup, and there's a maternity care subgroup, really working together in order to combat some of the findings of that study. But more importantly, there's a community engagement subgroup, because we understand the need to be involved in the community in this work, and not to just put in interventions without community input. And so I'm very appreciative of that. Through UPMC, I've also had the ability to work with the Black COVID Equity 19 Coalition. That is a group of researchers and philanthropists and politicians, community, workers, publicists, right? So a group of amazing people that have come together to look at COVID-19, the effects in the community, but also how do we bring together everybody to work and focus on this? And so being able to work with Allegheny Health Network and UPMC with the health department, bringing in our federally qualified health centers to ensure that the communities that we knew would be affected had resources. So that has been just a wonderful thing. I think UPMC's willingness to, look at other models of testing. They, in the beginning did not have a mobile van to be able to go to communities to do testing. And we've done 2 testing, community testing sites. So in McKeesport, there were 2 drive-through events. And then they went to a senior housing in Lincoln Leamington, which I think is amazing for our system to do.
And finally, as a family medicine doctor with young people out and about more and students trying to go to school, what are your main concerns looking towards fall and the end of the year as we continue to do with this pandemic?
Yeah. So as a mother of children who are returning to school, I really want to make sure that we are all trying to teach our kids about wearing masks and social distancing. I know our kids have kind of been in this bubble where they haven't really interacted, and so continuing to stress those things every day. But also I'm excited that they get an opportunity to go out of the house, and I just really want to focus on keeping them safe when they go. And so working, knowing what your school districts are doing to keep our kids safe, knowing what the government is doing to keep our kids safe, I think are things that in the community that we can all focus on.
All right, Dr. Tracy Conti, Executive Vice Chair for the Department of Family Medicine at the University of Pittsburgh School of Medicine. Thank you so much for your time.
Thank you.
Watch PCN's coverage of Pennsylvania politics and policy, history and culture, sports, and more with the PCN app. Stream live events and video on demand in HD from your favorite device. Go to PCNTV.com to start streaming today.
I'm here with Cheri Rinehart, President and CEO of Pennsylvania Association of Community Health Centers. Thank you for being with us today.
Thank you for inviting me.
During this pandemic, what are some of the unique challenges that community health centers face that large hospitals or health networks might not?
One of the biggest challenges in the beginning was having to switch to telehealth very quickly. That was not unique to health centers, but they didn't have any experience doing so, and I was so proud of how quickly they were able to do that.
And speaking of telehealth, many health centers across the state have embraced telehealth because of COVID-19. Do you see that as something that's been effective and will be effective in the future, even after the pandemic?
We absolutely do. It is a nice option for patients now. And what we have found is that patients are more likely to be able to keep their appointments because it addresses what we refer to as some of the social determinants of health. So they don't have to worry as much about transportation, childcare, taking time off from a job that they might not have sick leave from. And it has meant that people are able to make appointments and we can better help them get well and stay well.
Because so many people have experienced economic hardships during this pandemic, have you seen that more people are choosing to go to community health centers rather than hospitals or other doctors?
I don't have a comparison of where they're going, but I will say that even before the pandemic, over 900,000 Pennsylvanians were going to community health centers and continue to go there. There are more people that we didn't serve who are seeking care at our health centers because we are open to everyone. So whether you're elderly and insured by Medicare, or you're insured by Medicaid, commercial insurance, or you don't have insurance, we don't want ability to pay to get in the way of you accessing care and receiving care.
At the beginning of this pandemic, many healthcare institutions cited having difficulty getting certain resources like PPE and ventilators. Has that issue been remedied as we've gone through the pandemic?
It has certainly gotten better. I wouldn't say it's completely remedied, but it is specific parts of and pieces of PPE. personal protective equipment. So for example, as we've been able to reopen our dental, because most of our health centers offer not just medical, but mental health care, dental health care, some offer vision, and a whole variety of other services. But as we've been able to open dental, we've needed more N95 masks, which are the high protection masks, and it's hard to get small ones. And some of our folks need small ones.
Looking towards the rest of the year, how are you advising other community health centers across the state to prepare for fears of a possible second wave, as well as flu season coming up at the same time?
Preparing for what comes next is in their DNA. A lot of the health centers have developed processes to reduce risk for those who choose to come into the health center for care. So they might have screening tents or other ways to diminish risk. That's fine when the weather is nice, but it's less effective when it's cold out in Pennsylvania. So our health centers are gearing up for alternative ways to keep people who come in safe, and that's one of the things that they're working on. The other thing is trying to get people back into care and caught up on immunizations. It is so important that the immunizations that we've had around for a long time, that children are up to date, that adults are up to date. And this year, more than ever, that you get your flu vaccine. You can have both COVID and flu. I don't think you want either of those, but if you can diminish your risk of having at least one of those, you certainly should do so. So even if you're someone who says, I've never gotten the flu, I'm going to take my chances, and that was your thought in the past, I would strongly urge you to reconsider that for this year.
We've seen, as you mentioned, we've seen this pandemic has disproportionately affected underserved, usually black and brown communities. How are you advising other community health centers to address the needs of those specific communities?
And that's what we do. We are predominantly there to serve the underserved. Although, as I said, we are here for everyone. It might be helpful just to give a little mnemonic on what a community health center, also known as an FQHC, is. So the F in FQHC, fees based on ability to pay. So if your income doesn't allow you to pay the cost of care, we will scale down that to make it affordable. The Q in FQHC is quality healthcare for all, with the emphasis on the quality and the all. Every FQHC, not just in Pennsylvania, but across the nation, has to make their data available publicly by individual health center so that we can show you that we provide quality care. This past week, 39 of our health centers received national quality awards, and we're really proud of that. The other part of that is the all. We are open, and I know I've said this before, but we're open to everyone. If you're between insurance, if you have insurance, if you're employed, if you're not. The H in FQHC, highly competent health professional team. We really aim to be your one-stop healthcare home. So whether you have to have your tooth filled, or you have to have an exam, or you need to get your immunizations, we're your one-stop shop. And then the C in FQHC is what really distinguishes us, and that's community/consumer control. The governing board of every FQHC across the nation is at least 51% patients served by that community health center. And that's to keep us true to the communities that we serve.
And finally, as president and CEO of PACHC, what are your main priorities or concerns moving towards the rest of the year as we continue to deal with this pandemic?
Always being prepared. There has been so much change as we learn more about this virus. And so we have to be prepared to shift how we respond as we learn more. I think that The Wolf administration has been doing a good job of keeping us informed. We just need to be responsive to change and understand that it's part of science and it's part of learning as this virus evolves.
All right, Cheri Rinehart, President and CEO of Pennsylvania Association of Community Health Centers. Thank you so much for your time.
Thank you so much.